A thrown out lower back is just a vague term for my low back hurts really badly and it feels locked up, it feels thrown out, and I can't move very well. A thrown out lower back can last a couple of days, sometimes it can last a month or even longer. There are already a lot of videos out there that describe the quick fixes for a thrown out low back, or they just talk about one technique. In this video, what I want to do is be very thorough with you, and I want to give you the different options that are available out there. So different ways that you could diagnose it so that you can see which stretch is better for me. Should I do this nerve flossing technique that I see all over the internet and all over YouTube? Or should I do the one where I lay on my stomach and bend back? Or do I need something else entirely different? And so my goal with this video is to walk you through these different strategies so that you can get a better understanding of what's going on with you, so that you can find the more appropriate solutions for what's going on with your low back. Now first, a couple of things. This one's really important. It is hard to diagnose acute low back pain or a thrown out low back, even if you're in a medical doctor's office. And the reason why is because the structures are so close together and there's usually muscle spasming going on that everything hurts. It hurts to bend this way and it hurts to bend this way. It hurts to put on my socks and shoes and it hurts to rotate. So sometimes because everything is so challenging, you can't get a clear diagnosis right away. Now, that's not going to prevent us from trying. So I am going to kind of give you some tips and tricks and rules of thumbs to try to help you out. But I also want to be very clear, realistic, that you might not always have all of the answers just by watching this one video. Now, the good news is, a lot of times with this thrown out low back, there are a series of stretches that work well no matter what the cause is, and I've already made that video for you. So feel free, click the link above if you want to go straight into the series of stretches for a thrown out lower back. All right, if you are still watching, it means that you want to try to figure out some of these answers for the low back pain. And the first thing I'm going to go through, these tests are the easiest. They're not going to injure anything, hurt anything. Actually, none of these are going to injure or hurt anything. This one in particular is pretty simple, and we're looking for nerve tension, signs of nerve tension, and or anything disc related. The first one is pretty simple. You take a big breath in, hold that breath, and then bear down. You're straining as if you're kind of like about to cough, but you didn't let out the cough. If you're having a bowel movement, those kinds of things. It pressurizes that low back spine area. So if you do that, a big breath in, and then the bearing down, and during the bearing down, you feel like, wow, that really lights up that area where you have your pain on one side or the other. Maybe it's the left, maybe it's the right, maybe it's right in the middle. Especially if you feel that, and it kind of radiates when I do that, it radiates into the back of my hip. It's not a definitive diagnosis, but it's definitely a little check mark in a box that says this might be coming spine related, maybe from a disc or a nerve, like think the pinched nerve, sciatica kinds of things, if you have that one. So the next one past that, or the next orthopedic test, is something called a slump test. And this is going to either put another check mark in another box that says maybe nerve tension disc related or maybe not. You would bring your chin to your chest. And what that does is it pulls, it kind of puts a tension on your spinal cord to go upward. And then what we're going to do is bring this leg out like this here. If you feel that same pain back in here, somewhere along here, and then you look up and it seems like it's relieved. You look back down, and it feels like it's worse when you look down, chin deep to chest, or when you go up, it's relieved. That is a big sign that you've got something called nerve tension, and it might be more disc related or nerve related. Now, another thing you can do is that chin to chest, you go down here, flex this foot back and forth. When you bring your toes more towards your body, your knee is really straight, you bring your toes to your body, whoo, that lights that up. I really feel that back there where my pain is, but when I go that way, it lessens it. So one of two things, toe, foot going this way makes it worse, or chin to chest makes it worse, or looking up makes it better, or toe goes that way makes it better. All of those are signs and big check marks in boxes that say this might be more disc related, this might be more nerve related. And if these are the cases, This is where something like spinal decompression therapy might work really well for you. These are the cases where nerve flossing strategies might work well for you. I've already made a video on that, so I'm going to put it up here right now and it'll be in the description. But you're a candidate for these nerve flossing techniques. You're a candidate for anti-inflammatories. You're a candidate for that spinal decompression therapy. So next one I want to talk about is, what would it feel like, or what would bother me if it's the small joints in the back of my spine? They're called the facet joints. And when those facet joints are irritated, usually things like bending backward hurts more, especially if it's on one side. So if you kind of did a rotation and then a backwards bend, and if that's what bothers you the most, ooh, I really get it. It still might hurt to bend forward, and bending, lifting. When you do that, you're using those muscles and it's compressing on those joints. But especially if there's like this kind of stuff here, ooh, some people will stand on one leg, ow, that really gets me. That usually is an indicator, hey, it might be that facet joint's locked up, and then you might have some muscle guarding around that joint that's locked up. In those cases, all of the stretches in the video that I described for stretches for thrown out low back could be valuable. This is the case where maybe a chiropractic adjustment, spinal manipulation could be valuable. And then a lot of times soft tissue work, massage throughout that region feels really good. So a really popular technique and stretch is something called end range loading. It looks kind of like a cobra pose in yoga. The idea with this stretch here is they're looking for more subtle, minor disc bulges. The idea is when we bend backwards, it's trying to help drive that fluid in the middle of the fluid that kind of came out of the disc. The idea is it's trying to drive it back forward. So some people will get in these positions here and they may find relief. Now, I want to give you some tips and tricks when exploring this here. The people that need this stretch the most, sometimes it's a little uncomfortable to get into it in the beginning phases. So they'll get into it and say, oh yeah, that hurts, and then they stop. So if you really want to give this a full, honest effort to explore it and see if this is a good stretch for you, my recommendation is take your time with it and give it a little bit of a chance. So what you're going to do is come up here. And you're just going to hang out, really relax. You're not using any of your core muscles. You're just really relaxed on your forearms. Now, if you get any severe pain going down your leg, so if it's like my back was hurting, but now it's in the back of my hip, the back of my leg, radiating referral pain, stop this immediately. Come out of this stretch, get yourself on up. This is not the stretch for you, and don't try to do this again anytime soon. But if it's just more, it's stiff, it's tight in my low back. But if I can go in and out of this, it was tight the first time I did it, and then a little tight the second time, and actually now I'm easing into it. This actually might be a good stretch for you. That's the idea, and that's the goal, is to ease into these. And so what you would do is kind of come out, let it relax, and then go into it. And you do this several times, going into it and playing around with different depths. This you really have to listen to your body. You don't want to go too deep into it, so take your time. But if you felt like, hey, I actually eased into this quite a bit, and I feel like I can go a lot further now, well, maybe you could do more of a kind of a press up like this here. Really relaxed in your pelvis and let it sink, and then same thing. You'd come in and out of this several times to see how it feels. And some rules of thumb with this one, again, anything that was, my pain was back here, but now it's going down my leg, that is a immediately stop. This is not the stretch for you. If it was more of a, gosh, my hip and leg was bothering me before I did this, but now it just feels stiff and tight in my low back, or my leg pain feels better, or my back feels better, this is actually probably a great stretch for you to do. And then you just explore this. And again, if this extension technique gives you relief, that is usually a sign that you may have a small disc-related injury in there. But now the good news is, in my experience, that the severe ones usually don't respond to this. It's usually the smaller ones that do a better job with this here. All right, now if that last stretch where you're laying on your stomach and pressing back, If that did help you, and if you get up and you're like, wow, that actually feels significantly better, or at least 30 or 40% improved, what you really want to do is avoid anything that is flexion based in your spine, meaning you want to avoid sitting in these rounded positions like this here. You want to sit more upright, use like a lumbar spine support roll behind your back. You want to avoid things like bending over. You want to have a more neutral spine and use things like hip hinges or squats to bend. You want to avoid that rounding as much as you can for at least a few weeks as that settles down. So again, there's a few ideas to look at some different angles of what might be going on with your thrown out low back. If none of that, if you still feel like I have no answers, it still hurts, I highly recommend just go straight into our stretches for a thrown out low back. You may just have muscle guarding, muscle tension that developed from overuse. Sometimes we help a friend move, we do some gardening, we shovel some snow, and our muscles just get in this protective spasm state. You might just need to wait this out a little bit and do some stretches to help loosen it up while you're waiting. So I hope you got something out of this video. If you did, please encourage me to make more videos by either liking this video, subscribe to our channel is fantastic, and then of course, as always, leave some comments below.